How to manage adenomyosis if you're in your perimenopausal or menopausal years. Now, adenomyosis occurs when tissue similar to the tissue that normally lines your womb, which is known as endometrial tissue, grows into the muscular wall of your womb, which is known as the uterus. Now, that tissue continues to act in the same way as the lining of your womb does, so it thickens, breaks down, and then bleeds during your period. That can lead to heavy, painful periods and an enlarged uterus where it can become stiffened as well. And it shouldn't be doing that because these are dynamic organs that move around. Particularly as you approach the perimenopausal years, this is where we notice a disruption in your bleeding pattern, and you may experience pain at other times of your period as well. Many women who have adenomyosis will also have endometriosis. They're like the evil twins of the same condition that come together, whereas endometriosis are cells similar to the lining of the womb that grow outside. Now, the symptoms may get worse during perimenopause, and that's why it's usually the time that we pick it up, because adenomyosis will be leading to this bulky uterus, and we're not sure if all the symptoms get better, but for some women it can get worse. Particularly, we're still not sure if the adenomyosis, apart from the bleed going away when you're postmenopausal, whether that goes away, because we do now know that adenomyosis is a progressive lifelong condition unless you have a hysterectomy, which is the only cure so far. So you have your womb removed, and that seems to be the thing that makes sure that the adenomyosis goes away. So the first treatment that we might want to try with adenomyosis are over-the-counter medications like paracetamol or ibuprofen or Nurofen. These are anti-inflammatory medications. These help relieve pain, but also reduce the inflammation as well. Then there's medications like tranexamic acid. This will help control bleeding, or mefenamic acid, which can help control bleeding and pain. The oral contraceptive pill can really help. So oral hormonal options, such as a combined oral contraceptive pill, which contains estrogen and progesterone, these are synthetic, or the progestogen-only pill, known as the mini pill, which can also help stop your periods altogether. These can be beneficial if you're having heavy, painful periods and you need contraception at the same time in your perimenopausal years. Remember, HRT is not contraception. However, all of these medications contain synthetic hormones, which are different to the natural hormones in your bodies. And as you're transitioning, this can impact a group of women, especially if you have progesterone intolerance. So we need to be quite careful in that scenario. Some doctors might prescribe gonadotropin-releasing hormones. These are hormone-blocking drugs such as Zoladex or Rieco, which is a new one on the market, but you'll need to add back HRT with those treatments. These are, again, the idea is that it helps shrink down the adenomyosis, but also help with symptom control. The Mirena coil might be a brilliant option for those wanting to manage their adenomyosis as well as perimenopausal symptoms, and also if you want contraception. It's a small T-shaped plastic device that's placed into the womb by a doctor or a nurse or someone trained to put coils in. The Mirena coil steadily releases a type of progesterone, which is known as levonorgestrel, and can be used to reduce heavy, painful periods and improve symptoms of adenomyosis. Also, as well as double up your contraceptive if that's what you need, and it's effective as part of your hormone replacement therapy as the progesterone component of your HRT, and that will be the work that it can do for up to 5 years. It can take at least 6 months for the Mirena to improve your symptoms of adenomyosis, but if you were thinking alongside your Mirena coil to use systemic hormone replacement therapy such as a patch or a gel or a spray as part of your estrogen component of your HRT to manage your menopausal symptoms, then actually the Mirena coil can work really well as doubling up, as it does a number of different roles and also manage your adenomyosis at the same time. Then minimally invasive procedures such as uterine artery embolization. This involves blocking blood vessels that supply the uterus, which can shrink the adenomyosis and reduce symptoms at the same time. This might be a good option for those that are also managing their perimenopausal symptoms and their bleeding is going to be problematic because of the highs and lows of the fluctuations of the hormones. Then finally, if none of these options work for you and your symptoms are very severe, the surgical approach might be one that you consider. One option is a hysterectomy, so that's removal of the womb. And you might want to consider having your fallopian tubes and both of your ovaries removed, which is bilateral salpingo-oophorectomy. Now, you should only consider surgical options once you've discussed the risks and the benefits very carefully with your doctor and your long-term health outcomes for the future, and particularly to bone health, brain health, and heart health. Because once we take out your ovaries, that's known as surgical menopause, and then we'll need to think about how we replace your HRT, especially if you've got a background of endometriosis alongside that. I hope that's been helpful. As always, leave any questions down below.